Okay.
post it wherever.
Awesome.
All right. Hi, everybody. It is Dr. Brunjes here with Back on Track. We have Bex. I am so excited. I've been looking forward to this call. She just has some really amazing things that I think our community could, definitely gravitate towards and learn. So just a little bit about Bex, just kind of before we get started. I have this amazing little intro that I created for you. So hopefully it doesn't embarrass you too much. But Bex is a registered nurse. She's practices classical homeopathy, certified compassionate bereavement care provider, and a holistic health astrologer who brings a heart-centered, trauma-informed approach to healing. Your powerful story of turning your own personal grief and trauma into life of a service will deeply move and inspire, I know, myself and obviously our community as we approach this with individuals who I know are experiencing some of those same things. So from astrology and homeopathy to somatic dance and flower essence, Bex offers a truly integrative path for anyone navigating grief, identity shifts, and emotional pain. So without further ado, Bex, welcome. Once again, super excited to have you. Really looking forward to this. Just a little bit about, kind of tell us a little bit about what you have going on, a little bit about your journey, your story, kind of what brought you into all of this.
Yeah. So, I don't know how I ever even got into nursing. It was just something I always knew I was going to do. It's not like I came from a background in the healing professions or anything, but I just always knew I would do that. And I did for almost 20 years. And somewhere out of nowhere, one day, things just started to feel off with everything that I was doing. And I wasn't really sure what was coming next, but I kind of knew a change was going to come. And the unexpected loss of my sister to suicide in 2016 was kind of the catapult to where I am now. I watched the system fail her in her time of need. And then I went through my own traumatic journey with that. And on the skirts of that, finding out I was pregnant with my first child on the very first time of ever considering even going down that path. So needless to say, I kind of went from the worst moment of my life to what was supposed to be the best moment and not really knowing how to integrate either. And so through some dear healers, I was referred to a man who practiced a lot of these modalities within his work that I utilize for therapeutic recovery for myself. And in that journey, just really learning about new tools, Eastern medicine traditions that I had no clue about, and, just feeling at home, like really feeling like, well, yeah, like this makes sense. So that was kind of the start. And then it's just been one thing after another, as you kind of rattled off there. It's no wonder I feel so busy and tired. It's one thing when you're doing it, but to hear it all read back to you, it's like, oh yeah, okay. And I'm raising 2 small children. So that's kind of how I got here, because as they came into my life, right, everything became that much more important, supporting them and just really trying to set the best foundation for them as possible.
Yeah, absolutely. It is, when you're hearing it, it's a different feel than you writing something about yourself or, reading it. You hear it, those are amazing things. Not only that you're doing for you, for your family, but just in general for our population, our community that is in such dire need, having a lot of those same struggles that probably your sister was kind of going through. And
Right.
I appreciate you sharing that with us. Just the highs and lows of the emotions that probably came from that time of your life. It's overwhelming just to even think about. So just to actually be there in those paths. And it is one of those, I'm always, everything happens for a reason. And we do have shifts in our world that are hey, sometimes when we're going through things and it's nothing is going right, nothing is really planning out, no matter the amount of effort we put into it. I feel from the religious side of me, this is God navigating me, that something is different. Something's preparing me for a change, and a change that's going to be beneficial for not only myself, but like you mentioned, your family and everybody else surrounding. And that's that true nurture spirit. You just exude it. And I'm so fortunate that that's the path that you decided to go down so that you can help so many others. So okay, you mentioned a few of these modalities that you had learned. So what do you currently offer, and how do they kind of support individuals' overall well-being?
Yeah. So the newest, well, Well, actually, the newest tool is that I am coming Monday. I'm starting an integrative practice. It is my first movement-based practice that I will be offering. I'm doing it on a beta test, but it is like healing through dance. So the idea that when we can and it's free form movement, so it's not choreographed dance. It's meant to really just tune into your body and know what it needs and wants in any given moment. And part of my role is cultivating, crafting a playlist that is meant to support release of emotional patterns that are ready to break free from the body. Because when we don't honor and acknowledge our emotions and fully process them to their full extent, they can get trapped in the body. This is somatic, the idea of somatic experiencing, some of these other modalities that you may have heard of. And each emotion can kind of get stuck in a different part of the body. So anyway, crafting a playlist and encouraging freeform movement is greatly beneficial for releasing those trapped emotions that want to come out. Nothing is ever forced, and there isn't any right or wrong, good or bad. It's just a space where you gather. What was beautiful when I looked into doing this, it comes together beautifully. How I'm going to be offering it is doing it at the full moon. And the full moon phase, because this incorporates the astrological part of my practice and of my study, and the full moon phase is a time of release. So it is a time where we are universally supported to let things go that aren't working for us. And when we really focus that intention on the space that moon brings, each moon phase, each moon sign has its own themes that it relates to. So that's a newest thing. Just before that, the newest thing was that I did just finish classical homeopathy training. Homeopathy is a 200-year-old system of medicine that is rooted in treating the whole person, the mind, the body, and the spirit, recognizing that there are ways that we can get stuck in patterns that we just kind of need a reset button. And that's sort of what homeopathy is able to do. It is an energetic medicine in theory, but we are taking water, and a potentized medicine is what it's called, but it's really the energetic imprint of the healing properties of a substance. And it can act like a reset button, kind of like when your power gets tripped, you can keep walking around the house, flipping all the light switches you want, right? Like this is all of the other things that you're out there doing. But until you hit that main fuse box reset button, things aren't going to come back online as well. I do still offer traumatic bereavement support, and honestly, traumatic simply meaning that it's sudden, unexpected, and profound for an individual. So the only judge of that is the person and how they're navigating. So I do hold space for that for people that talking is their modality that is beneficial. I do empowerment work. But what I'm really most excited to get back to doing, I kind of had to take a step away from all of this. While I was in homeopathy school, it was more than full time.
Yeah.
It was more than full time. It was a lot more than I expected. But what I love doing is teaching and presenting workshops. And I want to get into doing retreats, either day retreats or even, immersive full overnight retreats and that sort of thing. I really love group work. There's so much power for people that thrive in group work that I want that to be an offering as well. And then, of course, astrology work, which is, people just knowing and understanding kind of what they came with, but then also like how are the planets still moving and affecting us in a daily basis. And, sometimes even just that understanding and awareness of where you're at timing wise astrologically can help people to just even acknowledge that like where they're at and what they're going through, it is for a reason. It doesn't make it any better or any easier to navigate, but it kind of helps to understand like, oh, this is just a phase. Like this is a part. And these are kind of the lessons that I'm meant to take from it. And we can either choose to suffer through them or excel through them, and we still get that freedom of will, but it just helps bring that perspective. So I think and really all of them are really, they just help people's individualized nature, people's individualized needs for healing. And so that is how it supports their overall wellness, because, people tend to want to say like, oh, well, you just need to go and meditate, or, oh, you just need to go and talk to somebody. Oh, you need to do this. Well, yeah, like maybe that's what works for you, but we're all individual beings. And so really finding that root of what's right for each individual is how you support their overall well-being. Because there are some people, if you tell them to go and do talk therapy or talk style therapeutic work, it's going to continually traumatize them every time they open up that
Yeah.
story, and so it's really just, that's how it's supportive to the overall well-being, because we're approaching it from the way they need, not the way they're told to do it.
Absolutely. It's just like, if you think about learning, we all learn differently, right? Some of
Exactly.
us are auditory, some of us are visual, sometimes tactile, right? So why wouldn't we all heal differently?
Right.
It's the exact same way if you think about from like a medical model. Not all medications work the same for every individual because we are all individually made and our components are all very different from each other.
Yes.
And I love that we now have all of these additional opportunities to really be able to heal ourselves and just kind of like be aware. I think so much of us, and I am a person, like just for me individually, that doesn't necessarily love to show a lot of emotions at certain times. I can be very emotional, but I just don't love to show a ton of emotions at times. And, that is most likely, and I feel like you'd probably agree, some sort of trauma response as to why I've, maybe created something along these lines at some point in time in my life. Right. But the idea of, like you were talking about, I don't love to talk about necessarily all the things. So that's not something that works for me. And I love that there are so many other opportunities that are now coming to light that allow people to just truly heal so we can have better emotional, mental, and then physical well-being, right?
Right.
Kind of how we do things in our practice too. We don't just adjust one specific way. That's why we have multiple providers. Like sometimes you're going to connect with one provider differently than you would another. And I just love that you're offering so many additional things to truly find what is going to work for somebody. So you can try this. Hey, you know what? That's okay. Like let's explore this particular area. Because especially in things like trauma and grief and just figuring yourself out, like that is such a large spectrum.
Well, and that's the deal, is like usually when people meet these spaces, trauma and grief and whatever that is for them, they really lose themselves.
Mm-hmm.
And that's kind of what happened to me. I had been the one that held it all together. I was the one that always knew the answer of what to do and how to do it. And I could just get things done. And my poor husband, because I fell apart and I had no idea what to do for myself. I didn't even know who I was anymore. Every part of my identity had changed within a matter of a month. I no longer resonated with my work. It felt like it was sucking the soul out of me. I didn't know who I was. I'd lost a huge hole in the family. And then that hole had been filled in a different way, which completely changed who I was as a person. It was no longer about me.
Mm-hmm.
But what was beautiful about that experience was it gave me permission to take care of me, because it wasn't about me. It was about my baby. And so, that was the beautiful thing. I did all of these amazing things with all of these amazing people that, yeah, I wouldn't be who I am today without it. But I could only give myself permission to do that because I was growing a child. Not everybody has that. And so, yeah, just having the different opportunities that sometimes it's a little gentler for people to move in. I forgot, I do Bach flower essence therapy as well. One of the most beautiful and gentle and supportive ways to just help people shift from one place to another and be ready to do other things, and or maybe not even need to, because they're so gentle and so loving on the whole person, mind, body, spirit. Because yeah, it's each thing is not for everybody, and it's not meant to be. And I just do my best to bring them all together, and offer that out.
Yeah. And it's just, you have very clearly spent a ton of time and your own personal energy to bring these. And I would imagine and I would hope that individuals would just say like, hey, like that's probably some of the hardest things for me too, is just to like let somebody else guide me, right? And that's what you're here for. That's what you have been designed for.
Yeah.
And what an amazing thing that like that's the gift that you were given. I think that's a pretty cool thing. And, obviously the circumstances that surrounded that help to put you in that position are not the most ideal, but there is that like the amount that you can give back to other individuals is, indescribable realistically.
Yeah, it's been a great honor. It really has. And it does, like, not that there is this requirement to find meaning or do something amazing with, a hardship. But what an honor it's been that I was able to do that, and I am able to do that. And I get small reminders all the time, especially, those God winks that right when I need them, like, oh, why am I doing this? And can I really do this? And, whatever, all the questions that, that go through my mind. And it just in the last 3 days, I held a couple of events over the weekend, and even the day before that event, when I'm kind of leading up to it and working up to it, I run into somebody that I worked with 4 or 5 years ago, and they just affirmed to me, like, you really just made just the space that you were able to hold just made such a difference in my life. And I'm fortunate that I also have people that kind of come back and give me those little winks, because sometimes, yeah, the work that I do, it's not for the faint of heart, but my heart is called to do it. And so it's a beautiful honor that I get to create this meaning from what I went through and move from there.
That is so true. I had a similar, just this past Tuesday, we have a patient who I've treated, husband, wife, and their multiple children. I had the honor of like being a part of some of their birth process, and they're moving across the state, and just to be able to have that connection, like, the husband was like, we'll just never forget you. You're part of our child's birth. Like you were here for all these big milestones in our life. And man, it had me like teary eyed. It had him teary eyed, and I was just like, man, this is just it is such an honor. And I think sometimes patients don't realize like how much it means to us that you've put your trust in us, that you're willing to divulge things that maybe are your deep inner being with you, like that is such an honor for individuals to have that comfort, and just to be able to be a part of people's lives that I think sometimes gets missed. Like we're not just doctors, we're not just healers, we're not just these things. Like we are here to serve, and when somebody allows us to do that, it is just such an honor. And it's not just about the next visit or the next appointment, or this is your x-rays. Like there's a true honor that comes from that. And I hope that our patients can see that. I feel like yours are probably going to feel that just from my small interactions with you, because you just have this like amazing ability. I have tons of questions that I could continue going on, obviously, but I just kind of like hone in on a few things so that way we can just like, how would you define holistic wellness, and what makes it different from those traditional models of care? And we've touched base a little bit, obviously, but how is it different?
Yeah. So I think a misconception a lot of people have is they think holistic equals natural. And so I really want to make that distinction. Holistic to me, and the approach that I bring, is that we look at the mind, the body, and the spirit. We can't look at one part. When we look at only one part, everything works together. And so you can't subdivide all of these pieces. And that's where I started to feel so uncomfortable in modern medicine, is that I was like, I mean, at the time when I stopped working full time as a registered nurse, I was a first assistant at a major academic center that is world renowned for, educating top doctors. And I was a surgical assistant in the operating room teaching these residents how to do their procedures. And, they would jokingly, they would jokingly complain during certain procedures because of the positioning, right? It's awkward. Like if you're right-handed and you're trying to work on somebody's left knee, it's a little awkward positioning. And so, they jokingly, like, well, blah, blah, blah. And when I get in practice, I'm only going to do right knees. And it was like, gosh, we've already subdivided the body into like bones and tissues and this and that, right? Like, and you have to go to this specialist for that. And I was like, really? Now you got to do the right toe and he can only do left toes? Like, come on. The whole thing works together. And so, it just goes back to that idea of like somatized experiences, that I think really at the core of any discomfort, dis-ease, these things that people navigate through, it started spiritually or emotionally. And it just sort of got stuck there somewhere. That my favorite quote that really embodies, I feel like, holism, really taking care of the whole person, was said by a guy named Henry Maudsley in the late 1800s. He was a renowned up and coming psychotherapist or psychiatrist in England. And he said, the organs or the sorrow which has no vent in tears will make other organs weep.
Mm-hmm.
And it's like, it's so true, you know, and each space has its own spot that it hides in our body. But so that's that's holistic medicine for me. And that's why it's different, because we're looking at the whole person. And not only that, in most holistic modalities, people get more than, your regulated 7 minutes with the practitioner.
Right.
You can hardly get through the niceties and the greetings, much less get into the stuff, right? So that's how it's different. And I mean, that's my passion about it.
Well, and obviously, like, you're taking an individual approach as to what somebody needs and offering
Right.
so
Not
many
protocol
different.
based. Yeah.
Yeah, like, that's why in our office, sometimes we'll have people who will come in and they're like, oh, well, my back hurts. And you're like, oh, okay, well, do you have any digestive issues? Are you having
Right.
headache? Because they're all connected and one
Right.
directly affects the other. And then it's like, okay, so now you've had headaches and your back is hurting. We're going to need to take some imaging. We need to see what that looks like. But then we might also send you for blood work, because
Right.
once again, we might not be dealing with a musculoskeletal issue at all. Right.
Right.
And I think it's sometimes hard for when a patient comes in and they're like, well, I've got back pain. Why are you not just looking at my back? Right. Because
Yeah.
it's sometimes nothing to do with your back. It's a
Right.
referral pain. It's like you're mentioning, like some trauma that is kind of pent up there. Like there's things that are happening in our body that when you can look at the body from a whole standpoint, and let's dive down to what is the true issue. Otherwise, it's just going to keep coming back.
Exactly.
And so, yeah, I mean, it's such a beautiful thing to have the acknowledgement and the recognition, like, nope, we have to look at this as a total thing. Like, you can have a specialty and I can, hey, you know what? I have diagnosed, determined this is the situation. I now need to send you to a rheumatologist. I now need to send you XYZ. But when we look at it as a whole, if we're not truly delineating where that is coming from, it's just going to be that repetitive cycle, and honestly end up a domino effect to lead to other things that didn't get resolved either.
Exactly.
Okay, so I have some interesting, like, about astrology. It's something I know minuscule amounts about, right? So how do you use astrology to help heal? Like, how is it a healing tool?
Yeah. So when I first started studying it, is because it was used in my therapeutic, trauma healing practice, that I, went to somebody and they would help me acknowledge what I was going through. But really what it is where the planets are positioned at the moment that you are born. It's kind of like taking a screenshot. I usually say snapshot, but I mean, I guess screenshot is pretty appropriate at this point. Yeah. And so it really, each and every planet has its own energy that they bring to the table, or the action that they're going to bring into your world. Every sign, like zodiac sign, has its own things that it sort of represents, like the descriptors, the adjectives that it'll bring. And then based on when exactly the moment that you were born, the time and the place, it starts to break the chart into areas of your life. So when I first started using it, it was being presented to me from a psychological standpoint. Kind of, this is who you are, and this is kind of how things are made up for you. This is kind of what may be important to you. These are the kind of things that like aren't so important to you. These are the things that you'll pretty much excel through, and like, here are some great areas for room for growth, aka potential challenges, right? Like, because we don't really grow if things are easy, right? Like we become stagnant when things are too easy, generally. So anyway, but obviously, so I started studying it from that standpoint. But it's honestly, medical astrology was a part of all medical doctor training up until about 200 years ago. Even like the RX symbol that is written for prescriptions was an indicator that was placed onto the chart to assure that the medical astrology chart had been reviewed for other potential causes. So medically or holistic healing wise, how it can be helpful is I can look at it and know, like, yeah, talk therapy is probably not going to be their thing. Like, they're not going to want to talk about it. Or, I had a client recently who, I always do a consultation call with people because I want them to know what the work is really about, because it is collaborative. It's not me doing their thing.
Oh yeah.
It's like they have to do their part, and I want them to know and understand what their part is. And also that, like, if you start and it's not for you, that's okay too. But also they get a sense of me. And really the true, as you already started to touch on, the true indicator of successful treatment of any sort is the relationship. Because if you can't be honest with me, or you can't come to me, or you don't feel comfortable with me, you're not going to be able to tell me what I need to know to support you. So, when I do that consultation call, sometimes at the end of it, I'll say like, hey, if you're comfortable, throw me your birth information, and I can even just look, like, maybe not even starting with me. So I had someone reach out to me. We talked. I said, hey, throw me your information. I put it in. I look at it and I go, hey, honestly, you need body work. Like I'm not a hands-on practitioner.
Yeah.
You need body work. Like there was so much concentrated energy in the part of her chart that it houses the physical body. It's like things get stuck there, whether they are or not.
Yeah.
And they're probably not even yours because of what's there and how they're working together. So like I highly recommend go get a massage with someone who is trauma informed, someone who is going to be able to care for you. You might do movement, physical activity, anything that is like actually moving the parts of your body. Like what I'm doing, it can help. It will eventually, but you're going to see so much more success. So it can be helpful in that way. But it also kind of gives me an idea of the susceptibility of a person. So, each zodiac sign like rules over certain parts of the body or certain ways that the body works. And then the planets have their own energy that they bring to them. And then even just looking at it elementally, knowing, different things. So like my oldest daughter, she has almost all fire and air in her chart. So I've got to cool her down. You know what I mean? And help ground her, because she'll combust or she'll burn out because she's just burning and going through everything. And so that's helpful to know, prescribing wise, especially with homeopathy. Like she likely needs higher potency medications more often because she'll burn through them. Whereas my youngest daughter, she has tons of water and earth. She's holding on to everything and absorbing everything. And I kind of have to let her just go with the flow, like she's going to kind of wander through life, and so that's how it's helpful. Even astrology probably saved my marriage, because at that moment when my husband had no clue what else to do for me, but he wanted so deeply to help me, and I had no way of explaining to him, we went to that practitioner and he told each of us about the other.
Yeah.
And so now I can let my husband fold the laundry, even though that towel is never going to be folded the way I wanted it to be. Guess what? The laundry is done. And I can choose if I want to be upset about that it's not done how I wanted it to be or not.
Yeah.
But that's not his thing. But you know what? Like this week, when I had a rough week, I had something come up this week that knocked my world on its side. Guess what he did? He did the laundry. He took care of the kids. He made sure that I had time and space to take care of myself. And he knows parts of that because he was able to get this insight into who I am and what's important to me where I couldn't articulate it.
Sure.
So anyway, I don't know if you can tell, but I'm passionate about all the things I could do. And I could also talk for hours.
Right. I love it. I love it so much.
But yeah, that's how it's helpful. It's like I can help direct people like, yeah, this practice is better for you, or, this is where your susceptibility lies. I had someone who came to me once who's his own Eastern medicine trained practitioner. He's like, I'm having this issue. No matter what I do, I've done all the things I know how to do. Someone gave me your name. I don't know. Maybe you can help me. We looked at his astrology and I said, have you ever thought about approaching it from this way? Because actually everything I'm seeing here is like your gallbladder somehow it comes back to this part. And he's like, oh my gosh, I never thought of it that way. But what you're saying makes total sense. And yeah, now I'm going to do all my tricks from this angle instead of I was hitting it from over here. So anyway.
And sometimes you just need a different perspective.
Yeah.
Just that different, like, I find myself doing that. And I really try, especially with my kids. And I've actually had a conversation about this here very recently because I had a kiddo break his arm on Thursday. And so it was kind of the same thing. And I very much want to play doctor at that moment. Right. And I'm like, no, I need to be patient. I need to let somebody else, because I'm too invested in other directions. Right. Yeah. And so even to know that, like, us as providers, us as healers and caregivers, like, we still have to look at things from a different angle. Like that's, it's exactly the same way. I always, I just need to get an adjustment. Oh, I can do these additional therapies and modalities. But realistically, like I ate a meal that was terrible like that. So
Right.
that also coupled it with it. Right.
Right. Right.
So it's just so many things you have to think about and focus on. So
Yeah, absolutely.
I love it. Well, I would love to have another call with you like this because, like I said, I have probably 10 more questions that I was hoping to be able to get through that I would, like I said, I would just love to be able to have you again. This was so amazing. I know we've had a lot of people who, when they saw the announcement, messaged me specifically about bereavement and things of that nature who are, it's always happening. It does feel like it is just very, very strong right now that a lot of
It
people are
is.
dealing with out of a amazing, terribly trauma.
Astrologically, there are reasons for that.
We'll see. There we
Yeah,
go.
and it's funny because I went to homeopathy school thinking it was just another tool in my toolbox, and then when I got there, it was like, oh no, this is its own whole tool store, and it's this whole deal, and I really thought that like I was really going to just focus right in on homeopathy and only homeopathy for a while, to get that practice and to get that comfortability and all these things. And it's like, no, the grief time, it's time for mourning right now. There's so much that has gone on, and that as the planets have moved through this part of the chart that have all to do with like interconnectedness and collective mourning and potentially deep suffering and grief and loss, they're starting to slowly march into the area that is about the self. So people are going to be more ready and willing to come out and ask for what they need. And so I'm just so honored. Like I said, I did 2 events over the weekend. They were both grief based. I held them on International Bereaved Mother's Day. The Sunday before Mother's Day is a marked day for moms that have lost a child. Because what most people walk through the world and don't recognize is that some of those moments, those big holidays, the little holidays, any random day, right, can be so difficult. And so yeah, I'm fully embracing in the last couple of months, like, oh yeah, no, there's still a lot for me in holding mourning space. So yeah, happy to do it, honored to do it, and very blessed to be able to.
I think it's amazing. You had mentioned towards the beginning of our call, you have something coming up Monday. Like, would you mind telling us a little bit more about what that looks like?
Yeah, I mean, the thing coming up on Monday, it's a beta test. It is a private, invite. That's that heal through dance.
Yeah.
So I'm hopeful that I get good feedback. I'm going to do 3 sessions of it over this, the next 3 months. So it's at the full moon, each full moon. And if it gets good results, if I get good feedback on it, I'm going to certainly open it up to the public come fall. And if it gets really, really good feedback, I may even start to offer it just, more routinely than just the full moon. That's just an extra potent time. That's what's coming up then. But other than that, nothing in the next little bit because I'm adjusting to that. But yeah.
Yes, I can imagine.
Yeah.
And once again, you're still a mom and you're still, finishing all these other things.
Yep.
Like you've been a supporter of our practice and donate this amazingly adorable basket and I'm just super appreciative of the things that you have offered to myself. And I know, some of my staff members and things of that nature, and just being just an amazing individual who is selfless and just putting yourself to be able to be that servant heart. And I just am very appreciative that that's how you're here and we have you in our area, and for taking the time this morning just to chat with me.
Thank you for having me.
Yeah, I loved this morning. It's a great way for me to start off my Thursday, and I just truly appreciate you spending the time with us to do that. I would love, once again, for us to have another chat so we can go into more of, like how you work with other health providers.
Yeah, I have plenty to chat about.
Yeah, I love it. I should have anticipated that 30 minutes was not going to be enough time, just from my interactions with you and just from like doing a little bit of research and such. But I've really
nice to do it in chunks. It's nice to do it in chunks.
Yeah, I think so too. So I would love that. I know our community will be able to gravitate towards this. This is obviously going to be recorded, so people can always go back and watch it at any point in time whenever they need it. But Bex, if you wouldn't mind, just obviously what's kind of the best way for people to contact you if they could maybe utilize some of your services?
Yeah, absolutely. So my website will have all my contact information on it, just like my care, individualized, however you want to reach out. So my phone number will be there. You can text or call. My email, there'll be a direct form that you can fill out on the site. And my website is helper B as in boy or Bex, just the letter.com. So helperb.com. My sister called me B, and I was Aunt B to my nieces and nephews. So Helper B just seemed like the best way to honor the whole experience. So yeah, that's how you can find me. My information is all there. And like I said, I do my scheduling personally because like I said, I like to hold a consultation call with people first, a complimentary, just 15-minute. Let's make sure that what you're looking for is what I can help you with, or maybe you're better served in a different way, and go from there.
Yeah, can help put them in whatever direction is going to be best for them.
Absolutely. Absolutely.
But I love it. I hope you have a beautiful rest of your day.
Thank you. You too.
So
I'm off
much.
to recess duty. So
Oh, well, that'll be fun too. You know,
yeah, we'll
I don't
see.
know.
Inside recess duty has its own vibe, but we'll
Right.
see.
It does for sure. I was about to say, hopefully it's inside because it is still definitely raining here. So
Well, I don't know. I'd still think I'd rather have 30 to 60 7-year-olds outside in the rain, but we'll
yes,
see.
at least burning off some of that amazing energy that I wish I had a little ounce of it.
Yeah. Yeah, exactly. Exactly.
All
All right.
right.
Well, thank you
Thanks,
so
Bye.
much.
Bye, guys.
Bye.